Hello and welcome. You have joined our Medicare 101 workshop. My name is Cinderella Clontz, but you can call me Cindy. Just kidding, it's Cindy. Thank you so much for showing up. If you are about to turn 65 or you're currently working and over 65, congratulations, you are in the right spot. If you would like to grab a couple pieces of paper so that you can take notes, that would be super helpful. We are about to get started. I am the proud wife and mother of these four children here. I've been married almost 35 years. I'm the founder of Medical Coach Health Insurance. I am a Medicare specialist and retirement expert. I'm a Social Security analyst. That is a tongue twister there. I can help you with the best time to begin collecting Social Security if you're not already collecting. I love to garden, read, travel, and walk my dog Loki. And I like to think of myself as a coach and a teacher. We're going to be looking at medical coach, and AI has analyzed all of my reviews. They've generally praised me for my professionalism, highlighting that I am particularly capable and helpful coach, that I am mentioned for my expertise in navigating medical situations for Medicare. I do in-person learning and digital learning, and I am located in Peachtree City, Georgia. You can add me on Facebook, Cindy Clontz, or Metagram, or LinkedIn. I would love to see you there. Today, we are going to be talking about 5 survival tips of Medicare, and I'm going to be your guide. We are going to look at what original Medicare covers and the costs, how to avoid late enrollment penalties so that you don't turn into a pumpkin, learn the difference between Medigap and Medicare Advantage plans, and pick the right plan that meets your needs, and why you would want to work with somebody like me, a licensed agent. First and foremost, we're going to be talking about original Medicare, and that consists of parts A and B. Part A has a monthly premium of $0 as long as you have 40 quarters or more, which is equal to 10 years, or your spouse has 40 quarters or more. Part B is doctor coverage, and that premium is going to be $185 a month. It could be a little bit less or a little bit more, and we can talk about that in your appointment. As far as enrollment scenarios, we are going to be looking at 3 different enrollment scenarios. Either you are collecting Social Security benefits, or you are not, or you are covered on your work plan, your employer plan. Scenario number 1 is you are already collecting Social Security, and that is a real tongue twister. Try to say it 5 times fast. Social Security, Social Security. And if you are already collecting, you are going to receive your Medicare card in the mail 3 months before your 65th birthday, and $185 is going to be taken out of your check. And your Social Security card actually is a red, white, and blue card. It doesn't look like this. So, well, your Social Security card does, but your Medicare card looks red, white, and blue. And $185 is going to automatically be taken out of your check if you're already collecting Social Security. Now, scenario number 2, you are not collecting Social Security yet, And if you are not, you are going to sign up for Medicare in one of four ways. You are either going to go on ssa.gov and you click apply for Medicare, and you're either going to sign up for parts A and B, or you're going to sign up for part B only if you're over 65 and already have part A. Or you can sign up over the phone by making an appointment with Social Security, go in person, but you need to have an appointment made, or you can mail in your application. Now, your first bill is going to be a quarterly bill, so don't be alarmed if you get a big bill in the mail. You can change that after your first quarterly payment. On the back, it shows you how to select monthly, and you can have that 185 billed to you monthly. Next, we are going to be looking at scenario 3, and that's if you are still working and covered on your employer plan. You can either enroll in Medicare effective on your 65th birthday, or you can delay Part B until you retire and get it then. I would highly recommend, if you are in this scenario, that you make an appointment. We will discuss what you are currently paying for your health care with your employer, what your deductible is, what your copays are, and analyze which option would be better for you. Many times I have many customers that are still working and go ahead and go on Medicare because it's a lot cheaper, and usually your employer is happy that you go on Medicare. So those are two good reasons to go. Now, when your coverage would start, it would begin the first day of your birthday month. So if your birthday is like me, May 25th, or on the 25th of the month, your coverage would start on May 1st. The only caveat is, if Medicare is not already difficult enough, is if your birthday happens to fall on the first day of any month, then your coverage would start on the month before. So if your birthday happened to be May 1st, your coverage is going to start on April 1st. Now, this next slide, you don't have to take notes on. It's just to show you what the major exposures are of original Medicare. So the major exposures for Part A, you could have this $1,676 deductible up to 5 times a year if you were to go in the hospital that many times each year. Now, Part A is only your room and board. And so you can think of it kind of like an Airbnb stay. It only pays for your bed and your meals. Part B pays for everything else. And with Part B, you have this 20% co-insurance with no limit. And what that means is that if you have a $3 million hospital stay, you would be responsible for 20% of that, which is $600,000 if you only have original Medicare and nothing else. And so that is very expensive. So I wouldn't wish that on my worst enemy. And then you would also have these excess charges, which is 15% of the 20%. So there are a couple ways that we can go to cover your major exposures with original Medicare, and we're going to be looking at those shortly. And those are going with either a Medicare supplement or Medicare Advantage. So let's dive a little bit deeper and take a look with Medicare supplements versus Medicare Advantage. We've got the Medicare supplement option here on the left and the Medicare supplement option over here on the right. So if you want to draw a line down on your paper, you can write down that with a supplement, you've got original Medicare, parts A and B. A is hospital, B is medical, and then you would add your supplement over here or Medigap, and then you're going to have a separate Part D prescription plan, or you can just take a picture of my screen, whichever. And then on the right, you've got Medicare Advantage. And with Medicare Advantage, that's going to combine A and B into C, but you're still going to need A and B. Remember, B is going to cost you at least 185 depending on your income. And if you set up an appointment, we can discuss what your income is and how much you would pay for B. And then most of the plans are going to include Part D with Medicare Advantage as well. So let's look at the Medicare supplement. And if you want to, again, keep that line drawn over here down the screen, we've got Medicare supplement on the left, and we will be going over Medicare Advantage. With the Medicare supplement, you're going to pay that premium, 185 plus your supplement, which we'll go over the costs here a little bit later, but for now it's unknown. We are going to look at the coverage. So with Medicare supplement, this is the most comprehensive option. You are going to have lower out-of-pocket costs when you go to the doctor, but you will have a higher unknown cost up here for your supplement. The network is more broad. You can go choose any doctor that is contracted with Medicare, and that's called Medicare assignment. You don't need a referral, and then you would get a separate prescription drug plan. Now we're going to look at Medicare Advantage. And so with Medicare Advantage, you also have that 185 premium, but your Advantage plans are lower in price. A lot of those are 0 to maybe $30 a month. And with the coverage, you're going to have higher costs on your back end when you go to the doctor or hospital. Your network is a little bit narrower. You either going to have an HMO or a PPO. With an HMO, you have to stay in network. With the PPO, you can go outside of the network, but you may have to pay a little bit more. And your Part D plan is typically included with Medicare Advantage. And then you have these lovely extras like dental vision, gym, over the counter benefits, and sometimes they have a buyback towards this Part B. So it would make your Part B premium even less than the 185, which is really nice. So to compare both of these options side by side, if you want to take a picture of this screen here, you've got Medicare Supplement on the left, Medicare Advantage on the right. Both of them have that Part B premium. So you're always going to pay the 185 or possibly a little bit more if your income is higher. And with the Medicare supplement, I like to think of this if you want to write down a buffet. So you with a buffet you pay in, you get your food on the back end. And with Medicare Advantage, it's like a la carte. So you're going out to dinner and you may pay for your salad and your steak and your dessert. Or if you don't want a dessert that evening, you just pay for your salad and your steak. So that's kind of how Medicare Advantage works. It's similar to an employer plan, so most of you are used to that, where you've got deductibles and a max out of pocket. And with a Medicare supplement, you've got a broader network. You can go to see anybody that takes Medicare assignment. And with Medicare Advantage, you have to stay in network with an HMO, or you can go out of network, but you may have to pay more. And with Part D, this is a separate standalone policy. So you could have it be with another carrier than your supplement. With your supplement, you might have Mutual of Omaha or United Healthcare or one of the other carriers. And with Part D, you could have Humana or Aetna or Cigna. It just depends on which medications you're taking and which formulary the carriers have. But with this Medicare supplement, you're going to want to write down that you'll need to have a dental, vision, and hearing plan because that's not included. So that would be a separate policy. And then with Medicare Advantage, the fringe benefits are down here. You get all your little extras. So those are the two side by side. And no matter which one you choose, I would recommend looking at a cancer and heart attack and stroke plan. So with cancer, you will have out-of-pocket expenses if you're diagnosed with cancer. For example, after COVID, a lot of doctors are now prescribing oral medications instead of chemotherapy. Those are not covered by Medicare, so that could be a significant cost. Also, you could have travel expenses if you are going out of state or if you have a loved one that's traveling with you and can't stay overnight in the hospital, and those expenses could get high. Or you may want to have a treatment that is not covered by Medicare, like an experimental treatment. Those are all good reasons to have a cancer plan. Medicare does not cover all of your costs. I know that's a big shocker here, but it does not. We're going to be looking at some of the gaps in coverage. Skilled nursing is one of those areas that does have a gap. On Medicare Advantage, it will pay for your first 20 days at a $0 copay for Medicare Advantage. And after the first 20 days, you could pay 200 and almost $210 a day each day that you're in a skilled nursing facility. And then after day 100, you would be responsible for all of those costs. So it's important to write down that if you do not have a long-term care policy, that Medicare only pays for up to 100 days, and you could have to pay $16,000 if you are in a skilled nursing facility from days 21 through 100. Now, there's one other important thing, and this is listed in your Medicare and U book, and I'm sure by now you've got the whole thing memorized, right? But here it says that Medicare covers skilled nursing facility care after a 3-day minimum medically necessary inpatient hospital stay. So, in order to have skilled nursing coverage, you have to stay in the hospital overnight for 3 nights. So, you have to have that requirement met, plus Medicare will only pay for 100 days. And for those two reasons, we like to recommend an umbrella package of protection so that we can eliminate your major exposures. And for those very reasons, I would recommend looking at umbrella package number 3. So you would have your Medicare Advantage plan or your Medicare supplement plan with your prescription drug. You would look at having a cancer plan and either a dental vision hearing plan or a hospital indemnity plan. If you go the Medicare Advantage route, this would be the Medicare supplement route. And then we would look at having a recovery care plan, which is a skilled nursing facility plan, so that you would not have any gaps in coverage. Now, umbrella two would be if you already have long-term care coverage, that this route would be recommended. And then our minimum route would be getting your Medicare plan, whether that's Advantage or Supplement, and your cancer, heart attack, and stroke plan. So we're going to look at a Medicare supplement route. And this is our first route. We're going to be going over that in more detail. And we're going to be looking at some slides that we've already looked at just because this is a lot of information. And so this is one of the slides that we've already looked at, but these are your major exposures that I said you don't need to write down. But these exposures are why you want to look at a Medicare supplement. And so with this option, you would have original Medicare. Original Medicare pays 80%, and then your supplement is going to pay for most of the 20% that you have with that coverage gap. Remember, that's where we said that you could have that $600,000 bill. So you want to have a supplement or Medicare Advantage to cover that. And then if you go the supplement route, you're going to have a separate Part D plan. Now, with a Medicare supplement, it's also called Medigap. This is given to you by private health insurance carriers, and this is where I would sign you up with one of those carriers, and we would look at all of those different carriers and see which plan is the right one for you. So with some of those plans, you are going to have some out-of-pocket costs like deductibles, co-pays. If you have some co-pays or co-insurance, your supplement cost would be a little bit less. Some of them only don't cover the Part B deductible, which is that $257 deductible. And we're going to be going over those plans here next. So these are your Medigap plans. We have Plan A through Plan N. It's kind of like alphabet soup. It's making me super hungry. My stomach's growling over here. And Plan G and Plan N, those are the most popular plans. Plan G, you notice here, only doesn't cover that $257 Part B deductible, and Plan N doesn't cover that Part B deductible, and then there could be some excess charges and then some co-pays on there as well when you see the doctor. So to go over Plan G and Plan N a little bit in more detail, you might want to either write this screen down. These are on the supplement side, so you can write these both under your supplement page. You got Plan G can be anywhere from $100 to $200 a month, depending on your zip code, if you're a man or a woman, and if you're tobacco or non-tobacco. So be sure to tell me if you are using tobacco, because that will impact your price. And with Plan G, you're only going to have that $257 deductible that we looked at on that chart before. With Plan N, it's going to be a little bit cheaper, about $20 to $40 cheaper than Plan G. You'll also have that $257 deductible, and you could have some co-pays, $20 every time you go see the doctor, or a $50 co-pay if you go to the emergency room. And then you could have this excess charges, which is 15% of the 20% if your doctor doesn't accept Medicare assignment. This is super easy to make sure that all your doctors accept Medicare assignment. You can go on Medicare.gov and I can show you how to search them out. Normally, the only doctors that don't accept Medicare assignment are pretty much psychiatrists and psychologists, but I can show you how to verify that for sure. I really like Plan N, especially if you're not going to the doctor a lot. When is the best time to sign up for supplements, Cindy, you ask? Well, that is going to be 6 months before your 65th birthday. You're going to get the cheapest rates, you're going to avoid mistakes, and you're going to, voila, check it off your list. You are done. No more worries. You can tell people to quit calling you that you've already signed up. And each of these plans is standardized. They are standardized by the government, not by the company that offers it. So a G is a G is a G, just like an N is an N is an N. You may just pay different rates depending on which carrier you choose. And that goes by how many people are signed up for that particular plan with that particular company. And each company may offer a couple different benefits, like some of them offer silver sneakers if you want to go to the gym. United Healthcare, you have to have AARP if you choose to go with them. So that is an important note. But each of these carriers, like I said before, a G is a G is a G. So you don't have to be company specific and go with, if your friend told you, oh, go with United Healthcare or Mutual of Omaha, for example, it really makes no difference one way or another, other than the size of the company does matter and how many people are enrolled in that plan. And we are going to be talking about why you would want to work with somebody like me on these next few slides here. Myth number one is I must have to pay a fee to use a broker to get their help. That is not true. My services are free. I will never charge you a fee. I get paid to actually sign you up for either a Medicare supplement or Medicare Advantage. Once you are signed up with me, I will be your broker for life. I will never charge you a fee because I get paid from the insurance company. Myth number two, nobody works for free, so the insurance company must charge a higher price if I go through a broker like you. That is not true either. They charge you the same rate whether you go through me or whether you sign up directly with them. And I make this process a lot simpler. I narrow the plans down to the top three plans for you, and those are based on your medications and your doctors, and it's pretty obvious which plans are the best for you, so you don't have to study for hours and hours. I make this process a lot simpler. And myth number three is that if you get paid by the insurance companies, you must have a bias towards one company or the next. That is not true either. It becomes very apparent based on your health and your prescriptions and which doctors you go to, which company would be best for you. So to recap, there will never be any fees charged. You pay the same price whether you go through me or you sign up yourself. And I am not biased towards one company or the next. And now we are going to be looking at the last plan for the supplement option, which is your prescription drug plan. And this would be different based on your medications. And each plan this year has a $2,000 max out of pocket for your prescription drugs, as long as your drugs are on the formulary. And that's what I will help you with, is finding out which plan is the best for you based on your medications and the formulary of the plan. We are also going to be looking at Part D, late enrollment penalty, so you don't turn into a pumpkin. So we want to make sure that you don't receive this 1% penalty for every month that you could have had coverage but elected not to enroll. This 1% penalty is based on the average price of the Medicare prescription drug plans. The average cost is $40. So if you did not sign up for 1 year, you would have a $4 per month penalty for life. And if you went 5 years without having credible coverage, you could have an extra $20 per month on the Part D side, and you can also have a penalty on the Part B side as well. So you could really rack up costs there as well. So you want to make sure that you know exactly how to enroll, especially if you're over 65, so that that credible coverage that you've had, hopefully with your employer, will count, and I can show you how to make sure that you avoid those penalties. Now, our Part D process, how that works is I put your prescriptions into Medicare's online calculator. We look at what pharmacy you're going to, and we compare all of the plans available in your zip code, and then I would enroll you in the plan of your choice. We can reevaluate these plans every year from October 15th through December 7th. So to recap, you're going to have original Medicare, which is approximately 185. That is going to be your premium for most people. Then you're going to have your premium for your Medicare supplement, which, like I said, depending on the plan you choose and the zip code and other factors like tobacco and your sex would determine the price. So that's going to be anywhere from 100 to 200 a month. And then you would have your separate prescription drug plan, which that's going to be anywhere from 0 to $99 a month. And that is the Medicare supplement option. And then option number two, we're going to be looking at Medicare Advantage. And this is my lovely mama here. She's on Medicare Advantage and she really likes it. She doesn't go to the doctor a lot, so it's a great option for her. And Medicare Advantage does not follow original Medicare. You do have to have original Medicare to have it, but remember that A and B is combined into C. And so it is managed by the insurance company that you choose to sign up with. And most of the time, it's going to cover Part D. There are some unusual situations where people might have TRICARE for life, or they are federal employees with the government and they don't need Part D because their Blue Cross Blue Shield coverage may kick in, and those workers have the ability to have that great buyback, and it can pay for a lot of their Part B costs, that 185. So if you're a government worker or have TRICARE for life, Definitely sign up with me and we can talk about why you would want to go on Medicare Advantage and how that almost acts like a supplement. It's amazing. But with these Medicare Advantage plans, you're going to have co-pays and co-insurance and deductibles on the back end. And then they also have an out-of-pocket maximum. If you go this route, we always recommend looking at a hospital indemnity plan so that you can cover those costs on the back end. And then when you're choosing a Medicare Advantage plan, that goes by your zip code. So if you have a brother or sister in a different zip code or different state, they're going to have different Medicare Advantage plans. And the Medicare Advantage plans are determined by which doctors you see, which hospitals you go to, and which medications you're taking. So just because you are married and your husband is on one plan, that plan may not be the best plan for you, or your neighbor loves their plan. Maybe they're on Aetna, but you are taking different prescriptions. Aetna may be higher than United Healthcare, or vice versa, depending on which hospitals you're going to, which doctors you're going to, and which medications. That is going to determine the best plan for you. And of course, each plan is going to have its own separate benefits, the dental, vision, hearing. Some have more dental and vision than others. Some have that great give back. Some have over the counter. They all are going to have their own separate, unique benefits. When you sign up for Medicare Advantage is a little different than a supplement. Remember, with a supplement, you sign up 6 months before. With Medicare Advantage, you're going to sign up 3 months before you turn 65. And then you are going to be able to change your plan every year from October 15th through December 7th. If you change your plan, your coverage will start on January 1st of that following year. And then there is actually another enrollment period with Medicare Advantage. If it's not already confusing enough, you have from January 1st through March 31st to make a one-time change. And so to recap, we're going to compare the two options. So if you didn't already get a picture of this screen, you may want to go ahead and do that. We've got Medicare supplement option, and this is the most comprehensive option. With Medicare Advantage, I'm finding though that this is the most popular option, with 7 out of every 10 of my clients choosing Medicare Advantage. And with Medicare Supplement, you're looking at paying approximately $400 a month with a Medicare supplement option. And with Medicare Advantage, you could pay this 185. You may pay a little bit less if you have that buyback. You may pay a little bit more if your plan could cost around $30 a month, but this is definitely the more affordable option, but you would have some co-pays and co-insurance on the back end. So if you go this option, you may want to choose a hospital indemnity plan, and then remember with both options, a cancer plan is highly recommended. So both ways that you go, you are going to have some gaps in coverage. And umbrella number 3 is the most popular protection plan. It's going to give you your Medicare plan with your Part D. So whether you go the supplement route or Medicare Advantage, you're going to want to choose a cancer plan or a cancer and a heart attack and stroke plan if that runs in your family, and then a dental vision hearing plan if you go the Medicare supplement route, or a hospital indemnity plan if you go the Medicare Advantage route. And then your recovery care is your skilled nursing plan to cover the gaps that the skilled nursing doesn't cover with Medicare. So it would cover 100 days and beyond. And this is a short-term care plan. Now, if you already have long-term care coverage, that is good for you. So you would pick umbrella number 2, and that would cover everything but the short-term care. You wouldn't need that because you already have long-term care. And then umbrella package number 1 is our smallest package. That would be your Medicare package plus your cancer or heart attack and stroke. And now we're going to be looking at protecting your money in retirement. So that is a big change for you. So up till now, you've got your employer plan, and many of you have your money in either a 401k or a SEP or a Roth or a 403b, or you've got it in market driven accounts or some more liquid accounts. And so it is important to have your money be a little bit safer in retirement. And with that, these plans that we have available, and I have some partners that I thoroughly trust to protect your money. My husband and I are using those partners right now as we speak because we are 59 and a half, and so we're wanting to convert some of that money to safer options so that we don't have as much market volatility with the way that things are going right now. And with these plans, your principal is 100% protected from market risk. But the great thing about these options are that you can either have a fixed index rate with the indexes, or you can have a larger growth potential by following the S&P 500. And then these plans also have several withdrawal options. You can either have a one-time withdrawal option, or you can have options that give you a monthly stipend. So I love the monthly stipend option because we've worked really hard up until now, and I don't want to worry about the market volatility. I just want to have it pay a safe amount over time. And so if you do not have a somebody that you're working with to protect your money, I would highly recommend letting me know, and we can get an appointment set up with you for my partners for the retirement money options. So today we've gone over all things Medicare, and so I hope you've learned a few things. And we are going to be looking at our next steps. So we will, in our next steps, be looking at the best plan for you and which package of protection is best for you. You will also receive in that next consultation a personalized roadmap, and that is a step-by-step guide telling you when you need to enroll so that you don't get any of those dreaded penalties and you don't turn into a pumpkin. And you'll also get a cost summary outlining your total monthly cost. And then when you sign up with either your supplement or your Medicare Advantage plan, you've got all these added benefits. So our team can help you with free appeals. You'll get annual reviews every single year. We can help you with getting ID cards and rate changes, those kind of things. And so I hope to be working with you here shortly. You can either call me at this phone number, 770-758-1282, and there is a recorded message that we do have to play first, and then it will automatically transfer you to me. And so, unless I'm on the phone with somebody else or in an appointment, I will answer. So be patient. That little 30-second message plays first. And then this is my email, but if you would like to schedule an appointment with me, you can click on the blue calendar link below to schedule your call. I look forward to working with you here in the future, and thank you so much for coming. I hope you've learned a few things, and you have a wonderful day. We will see you soon. Bye bye.